Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Study reveals intensive blood pressure control reduces risk of cognitive impairment. A new study shows that only 3 years of intensive blood pressure control continues to significantly reduce the risk of mild cognitive impairment or dementia long after stopping this treatment in adults with hypertension and high cardiovascular risk. The findings are published online in Neurology, highlights the sustained benefits of aggressive blood pressure management in preventing cognitive decline. The National Institutes of Health supported systolic blood pressure intervention trial, SPRINT trial, memory and cognition in decreased hypertension SPRINT Mind study involved 9361 participants aged 50 years and older at more than 100 clinic sites in the United States and Puerto Rico. Participants were randomly assigned to a systolic blood pressure goal of either less than 120 mmHg or less than 140 mmHg. Systematic review shows antibiotics, vaccinations and anti-inflammatories may lower dementia risk. Antibiotics, antivirals, vaccinations and anti-inflammatory medications are associated with reduced risk of dementia according to new research that looked at health data from over 130 million individuals. In a study published in Alzheimer's and Dementia, Translational Research and Clinical Interventions, researchers led a systematic review of existing scientific literature to look for evidence of prescription drugs that altered the risk of dementia. In total, the team examined 14 studies that used large clinical data sets and medical records capturing data from more than 1 million dementia cases. Although they found a lack of consistency between studies in identifying individual drugs that affect the risk of dementia, they identified several drug classes associated with altered risk. One unexpected finding was an association between antibiotics, antivirals and vaccines and a reduced risk of dementia. This finding supports the hypothesis that common dementias may be triggered by viral or bacterial infections and support recent interest in vaccines such as the BCG vaccine for tuberculosis and decreased risk of dementia. Anti-inflammatory drugs such as ibuprofen were also found to be associated with reduced risk. Inflammation is increasingly being seen to be a significant contributor to a wide range of diseases, and its role in dementia is supported by the fact that some genes that increase the risk of dementia are part of inflammatory pathways. Weight loss treatment in children lowers long-term health risks, researchers. When children with obesity undergo weight loss treatment, the effects have repercussions later in life and the risk of serious health problems and premature death is lower as they reach young adulthood. However, this is not the case for depression and anxiety. A study from Karolinska Institute published in JAMA Pediatrics reports. The study included over 6,700 individuals who had received treatment for obesity during childhood identified via the Boris register and who were then followed up as young adults in the Swedish patient register, the prescribed drugs register and the cause of death register. A control group from the general population was also used, matched by age, sex and place of residence. Telephone therapy may reduce fatigue, improve mood and cognition in breast cancer survivors. A study demonstrates the effectiveness of telephone-delivered acceptance and commitment therapy in reducing fatigue's interference with functioning and improving the quality of life for survivors of metastatic breast cancer. The findings are published in Journal of Clinical Oncology. Researchers also found that the remote acceptance and commitment therapy intervention has shown evidence of feasibility and promise in reducing sleep interference with functioning of the patients. Cancer-related fatigue is often exacerbated by the physiological consequences of inadequate sleep. During the clinical trial, 250 survivors living with metastatic breast cancer were randomly assigned to 6 weekly telephone sessions of acceptance and commitment therapy or education or support. The results of the telephone-delivered acceptance and commitment therapy intervention suggest that brief remote conversations with the therapist help encourage the survivors to practice mindfulness in their daily lives, which leads to reduced fatigue interference with functioning. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.